Now we go to the water element, deafness, hair loss. The treatment for deafness is mainly with local points. We use triple wormer 17, small intestine 19. These points are given deep with the patient opening his or her mouth wide and stimulated to create a strong needle sensation, then pulled up slightly so the patient can close the mouth. The needles are left in for 20 minutes. Having lived in England for the past 20 years, sabi ng author, I find that children in the West have more problems accepting needles than those in Asia. I have used laser in Western children with good results. We come to a compromise that I will needle only 2 points each time, with the rest given with laser. This is because I feel that needling is still a superior to laser. So we use points GB20, the most important point in the head, especially for sensory organ problems. Triple warmer 5 is an additional meridian distal point as the triple warmer meridian circles the ear. LI4, the area distal point, stomach 40 as a damp circulating point is added if the child has a glue ears or mucus-related problems of the nose and throat. Do 15, this is a dangerous point at the nape of the neck, but is invaluable in the treatment of congenital deaf mutism and was discovered during the time of the Cultural Revolution in the 1960s in China. Sabi ng author, I have seen many patients with tinnitus in these years. My rate of success in these cases had been 50 to 60%. Many of them improved, but not all were fully cured of their tinnitus. I've not been able to predict the results beforehand either. Sometimes a tinnitus of 10 years duration can disappear with one treatment. Sometimes an acute tinnitus will not improve at all. As a result, I treat every patient with tinnitus for 12 to 14 sessions anyway, and tell him or her that there is a 50-50 chance of a cure. According to my experience, sabi ng author, there are 2 main types and a 3rd possible type of tinnitus. So we have here another tower diagram, kidney deficiency. So yin ang deficient, normal ang yang. Liver yang excess and wind, there is an excess of yang, normal ang yin. And dampness in lung, so excess po yung damp. Deficient ang qi. Sa kidney deficiency, there is a constant tinnitus, could be like TB hiss or running water or pulsing. Does not affect hearing. Patient could miss high-frequency sound such as the ringing of the phone. Tinnitus is worst in the evening and nights and does not disturb sleep. Starts gradually with overwork and lack of rest. Patient could have backache, loss of head hair, and be easily exhausted. Next, the liver yang excess and wind. There is intermittent tinnitus, like a high piercing whistle, makes the person very nervous and aggressive. Affects hearing when present, hearing normal when tinnitus is absent. Tinnitus comes on at times of stress, usually good at nights and in bed. Start suddenly with stress and tension. Patient could be tense, nervous, and aggressive with hypertension and migraine-type headache, loud voice, and red face. Next, dampness in the lung. There is intermittent muffled sound as if one is hearing through an earplug, feeling as if the ear is blocked before tinnitus appears. Hearing and other senses, smell, taste, etc. are dull. Tinnitus worst in the morning, on waking, and if nose is blocked. Starts on and off with chronic recurrent nose, sinus, and throat problems. Patient could have an edema on face and eyelids, nasal voice, and mucus conditions of respiratory system. Okay, we continue with kidney deficiency. The points used is triple wormer 17, small intestine 19, which is the local point. Li4, triple wormer 5, the distal point. GB8 and GB20, symptomatic. Kidney 7 may be also used, yung lung 7. Tonify kidney yin, treat twice per week, then once per week. Next, sa liver yang, excess in wind, we use the triple wormer 17, small intestine 19, which is a local point. Li4, triple wormer 5, the distal point. We use GB8 for symptomatic. Do 20 tranquilizing. Spleen 6, descending technique. GB20, liver 2, wind sedation. GB38, sedation to sedate liver yang indirectly and treat the patient 2 times per week. Sa dampness in the lung, triple warmer 17, small intestine 19, Li20, small intestine 17, and local points. Li4, triple warmer 5, the distal points. GB20, stomach 40, symptomatic. UB23, UB58, Shu of kidney, and Lu of urinary bladder. This is also suitable for deafness following glue ear. Then we treat once per week. Next, we go to the kidney nourishes head hair. A good head of hair is a sign of vitality, and when the kidney energy decreases, the hair follows. The body hair is nourished by the lung and should not be confused with head hair. It is normal to lose some hair during change of season, especially as the weather becomes drier, but this is relatively little compared with the hair we regenerate. But if a person is going through a period of overwork, poor sleep, breastfeeding a baby, or in menopause, situations that drain our vital essence, they could lose hair at an alarming rate. The hair could also become thin, brittle, and dry. This is because the kidney yin is deficient and storage of nutrients is poor. Spleen blood deficiency, or because liver blood deficiency. Improved nutrition and tonifying kidney yin and liver blood will stop hair loss instantly. Okay? However, if one is losing hair from just one part of the head, the temples and the vertex are quite common areas. This may be a symptom of excessive heat and dryness in this area only. The 4 areas of the head. First, sa front, which is the stomach and large intestine, the vertex, the liver and pericardium area. Sa sides, we have the gallbladder and triple warmer. And sa occiput, we have the urinary bladder and the small intestine. We have already discussed, sabi niya, the 4 regions of the head in the section of the head. Associating these areas with different organs is also useful in problems of head hair and diseases of the scalp. Hair loss from the vertex. Local treatment. When there is some hair, 4 local subcutaneous needles in the area with continuous electrical stimulation. We use 10 Hz for 20 minutes, 2 sessions per week. When the patient is completely bald, plum blossom needle tapping in the entire area to cause bleeding. Done daily up to 14 days until small hairs appear, then electrical stimulation. Sa points, we use kidney 7 to tonify kidney yin. Treat liver imbalance, liver 5 blue point with GB40 sedation, which is the U1 source point. So here, fire heat in the liver area of the head. Excess of yang. Advice against consumption of alcohol, excessive red meat, coffee, and other food that would increase body heat. Lung 7, which is the Lu point, tonifies yin and sedates yang. This point helps as scalps is part of the skin, and tonifying the yin of lung would tonify yin of the skin. Healthy looking hair. The appearance of head hair, whether it is bouncy and shiny or limp and dull, is dependent on the kidney yang and qi. Nowadays, we depend on many cosmetic products to achieve this look, and they actually make the hair worse over a period of time. But what seems to matter is the short-term boost, not long-term vitality. Hair is full of life in a person who has healthy sex life. Although a man would indulge in excessive sex and waste his kidney yin, which is the jing essence, could lose hair. Regular and moderate physical exercise also keeps the hair shiny and glowing. If the kidney yang is deficient, hair seems to go limp and dull. Next, we go to the premature graying of hair. Premature graying of the hair is a sign of kidney yang deficiency. Sabi ng author, I have been asked what is premature graying. Well, one gray hair before 35 in a woman or 40 in man, it has been observed that people would become gray in a day when subjected to a great fear or worry. If one feels trapped in a situation that creates fear or worry and can do nothing to escape from it, this can suppress the kidney yang and cause graying of hair. A simple but effective way to change their hair color back to normal, yes, sabi niya, back to normal color, is to do headstands for 10 minutes a day. Maybe this is not an ideal position for everyone, but one can lie on the bed and bring the head below the bed level and holding this position for 10 minutes. The idea is to send the blood to the head. Over a short period of time, within days, the hair color will change back to normal. So, try po natin, pababa po yung ulo. Gray hair usually occurs in certain areas of the head. The sides of the head are commonly affected. This is because the yang in these areas is weaker than the rest of the head. And this is a damp stagnation in the meridians. It helps to treat the meridian. For instance, if the sides are very gray, they would use point GB37, which is the low point, or triple warmer 3, the tonification point, to remove stagnation and tonify yang in this area.